Most people have no idea their blood sugar is high. 80% of diabetics worldwide remain completely undiagnosed right now. You could be one of them and never even know. High blood sugar is one of the most silent killers. It creeps through your body slowly and destroys everything inside. Your kidneys, your eyes, your nerves, and heart are targeted. It does not announce itself with dramatic or obvious warning signs. Instead, it whispers quietly while the damage compounds every single day. Today we are going through the top 10 warning signs. These signs could literally save your life or someone you love. Pay very close attention because some of these will shock you. Before we begin, here is the most important fact today. A simple blood sugar test can completely change your health outcome. It takes minutes and it costs almost nothing to get done. But first, you need to know what your body is saying. Let us start with number 10 and work our way up. Number 10, nausea and vomiting. Most people brush off nausea as something they simply ate wrong. But persistent nausea combined with vomiting is a serious red flag. When blood sugar spikes dangerously high, your entire body goes into panic. It desperately tries to flush out excess glucose through your urine. This rapid fluid loss throws your electrolytes completely out of balance. Electrolytes control nearly every function that your living cells rely on. When they fall out of balance, your stomach suffers very first. Nausea sets in quickly and then vomiting follows right behind it. But the story gets far more dangerous than just that alone. High blood sugar can trigger a deadly condition called ketoacidosis quickly. Ketoacidosis happens when your body simply cannot access glucose for energy. So it starts breaking down stored fat as an emergency fuel. This fat breakdown releases toxic byproducts called ketones into your bloodstream. Ketones accumulate fast and begin poisoning your blood chemistry from within. This is especially dangerous and common in type 1 diabetic patients. But severe type 2 diabetics can also experience this deadly condition. Left completely untreated, ketoacidosis can spiral into a fatal emergency fast. If you are vomiting and cannot keep fluids down, act immediately. Go to an emergency room and get your blood sugar tested. Never assume that nausea is just a minor stomach bug issue. Your body is not overreacting, it is begging you for help. Number 9. Persistent dry mouth and extremely dry skin. This symptom does not require dangerously high blood sugar to appear. Even moderately elevated glucose can trigger this very uncomfortable daily experience. When blood sugar rises, your kidneys go into serious overdrive mode. They pull massive amounts of water just to dilute that glucose. Your body loses far more fluid than you are actually replacing. The result is a state of constant low-grade daily dehydration. Your mouth feels dry no matter how much water you consume. Your lips crack painfully and your tongue feels like sandpaper constantly. Your skin becomes flaky, rough, itchy, and uncomfortable throughout every day. The sweat glands also become affected by this ongoing dehydration process. Less sweat means your skin completely loses its natural moisture barrier. Diabetic skin often cracks badly at the heels and between toes. These cracks become dangerous entry points for serious bacterial skin infections. A small wound on a diabetic foot can turn absolutely catastrophic. So dry mouth and dry skin are never just cosmetic daily issues. They are your body whispering loudly that something is deeply wrong. Stay very well hydrated and use a quality moisturizer every day. But more importantly, go and get your blood sugar properly evaluated. Dry skin is a serious symptom, not just a skincare problem. Number 8. Fruity or sweet-smelling breath.
Most people assume sweet breath simply means someone just ate candy.
But in diabetics, that sweet smell is actually coming from inside. It is produced when ketones are being exhaled directly through lungs. Remember, ketones are released when the body burns its fat reserves. When ketone levels get high enough, they escape through your breath. Paramedics have mistaken this distinctive smell for alcohol intoxication many times. The patient was not drunk at all. They were in serious danger. This life-threatening condition is called diabetic ketoacidosis and needs emergency care. Fruity breath combined with vomiting, confusion, or rapid breathing is critical. Call emergency services immediately if you ever notice this dangerous combination. Do not wait and hope that it will simply pass on its own. Ketoacidosis can turn completely fatal within hours if it is left untreated. Your breath should never smell sweet without a very obvious dietary reason. This is one of the most overlooked and misunderstood warning signs today. Teach your family members exactly what fruity-smelling breath actually means medically. They could genuinely save your life by recognizing just this one sign. Early intervention in ketoacidosis dramatically improves both survival and full recovery outcomes. Never ever dismiss an unusual smell coming from someone who seems unwell. The 5 minutes it takes to call for help could save everything. Number 7. Presence of ketones in urine. This sign directly connects to the ketoacidosis process we just discussed. Your kidneys try hard to remove excess ketones by filtering them out. So those dangerous ketones end up highly concentrated inside your urine output. You can actually test for ketone levels at home incredibly easily today. Urine ketone test strips are available at most pharmacies without any prescription. A positive result means your body is in very serious metabolic trouble. High ketone levels in urine mean your insulin is failing completely now. Your cells are starving even though glucose is flooding everywhere in blood. This is the cruel and devastating paradox at the heart of diabetes. Staying well hydrated is absolutely essential when ketones are detected in urine. Water helps your kidneys flush those dangerous toxins out far more efficiently. But hydration alone is simply not enough to solve the root problem. You need immediate professional medical evaluation and very likely insulin intervention soon. Ignoring ketones in your urine is exactly like ignoring smoke at home. The fire has already started, even if you cannot yet see flames. Act very quickly and get proper professional medical care as soon as possible. Home testing is a genuinely useful early warning tool for all diabetics. Make urine ketone strips part of your regular ongoing health monitoring routine. Catching this warning early can prevent a full ketoacidosis crisis entirely. Number 6. Shortness of breath without any physical exertion. You are sitting completely still and suddenly you simply cannot breathe comfortably. This frightening experience happens because high ketone levels disrupt blood acid balance. Your body desperately tries to correct this dangerous imbalance through rapid breathing. This specific breathing pattern is called Kussmaul breathing in proper medical terminology. It is your lungs desperately trying to blow off dangerously excess acid. The respiratory system becomes a last resort buffer for your disrupted blood chemistry. This is an extremely serious and always urgent warning sign to recognize. Unexplained breathlessness combined with any other symptoms demands immediate emergency medical attention. Do not try to sleep it off or wait until the next morning. Many people mistakenly assume shortness of breath is simply anxiety or stress. Others incorrectly blame it on being out of shape or slightly overweight. But if it comes without exertion and feels deeply abnormal, investigate immediately. High blood sugar affecting your breathing is your entire body screaming loudly.
It means multiple critical body systems are now under simultaneous and serious stress. Getting your glucose fully under control is the only real long-term solution. In the short term right now, get to an emergency room immediately. Oxygen levels, blood pH, and glucose all need urgent and professional monitoring today. Never minimize respiratory symptoms in someone with known or even suspected diabetes. Breathing problems in diabetics are among the absolute most serious warning signs possible. Number 5. Confusion and severe difficulty concentrating. Your brain is the single hungriest organ in your entire human body. It consumes more glucose per gram than any other tissue you have. When blood sugar swings dangerously high, the brain becomes severely disrupted fast. Neurons simply cannot regulate properly inside a high-glucose, toxic brain environment. Inflammation begins actively affecting how critical signals travel between your brain cells. Mental clarity fades completely, and even simple daily tasks feel impossibly hard. You forget words mid-sentence, or you lose track of basic conversations entirely. This is absolutely not just tiredness or stress causing these serious problems. This is your brain under genuine and devastating biochemical attack from glucose. Caregivers and close family members often notice this frightening change before the patient. Someone who was always sharp and clear suddenly seems confused and distant daily. They repeat questions endlessly, lose their keys, or forget even familiar faces. These cognitive symptoms are deeply alarming when they begin appearing in clusters together. They are reversible only if blood sugar levels are properly addressed quickly enough. But prolonged high blood sugar causes lasting and serious neurological damage over time. Diabetic dementia is now a recognized and rapidly growing area of medical research. Protecting your brain every single day means protecting your blood sugar every day. If someone you love seems consistently mentally foggy, consider getting them professionally tested. Cognitive decline from uncontrolled diabetes is absolutely preventable when it is caught early. Number 3. Severe and unexplained fatigue or constant drowsiness.
You sleep a full 8 hours and still wake up completely exhausted daily. You drag yourself painfully through the day, needing multiple coffees just to function. By 2 in the afternoon, your energy has completely and totally collapsed again. This is one of the cruelest symptoms of chronically uncontrolled high blood sugar. Your blood is absolutely flooded with glucose, but your cells cannot access it. Without insulin working properly, that available energy stays permanently locked outside your cells. Your mitochondria, the power generators inside your cells, are running completely on empty. Your entire body is literally swimming in fuel it fundamentally cannot access at all. The fatigue from this cellular starvation is deep and unlike any normal tiredness. There is a very persistent myth that sugar gives people more daily energy. Parents blame birthday cake when their kids seem especially hyper and energetic afterward. But research consistently and clearly shows sugar does not cause hyperactivity in children. Kids are energetic simply because they are kids, not because of dietary sugar. The real and important truth is actually the complete opposite for diabetic people. More glucose piling up unused in blood actually leads to far more exhaustion. The more sugar accumulates without being used, the worse your fatigue becomes daily. If you are chronically and deeply tired despite adequate regular sleep, please get tested. Fatigue this deep, persistent, and consistent is your body absolutely begging for help. High blood sugar remains one of the most completely overlooked fatigue causes worldwide. Number 2. Excessive thirst paired with constant frequent urination. This classic pairing is one of the original textbook warning signs of diabetes. Your kidneys can only physically handle a certain safe concentration of blood glucose. When sugar levels exceed that critical threshold, they start spilling glucose into urine. To dilute that spilling glucose, water gets pulled urgently from surrounding body tissues.
More fluid constantly leaving your body triggers an intense and completely unquenchable daily thirst. You drink more water, you urinate more, and the exhausting cycle never ends. Nighttime urination is especially telling as a warning sign and should never be dismissed. Waking up 2 or even 3 times nightly just to urinate is genuinely abnormal. This destructive cycle of relentless thirst and urination is called osmotic diuresis medically. It means your body is stuck in a continuous and dangerous fluid loss crisis. The dehydration this constant cycle creates affects every single organ and cell you have. Your skin, your eyes, your kidneys, and your brain all suffer from this loss. Many people mistakenly assume they simply have a small or slightly overactive bladder. They never connect the obvious dots between nighttime urination and elevated blood sugar. That connection is absolutely critical and could entirely change the course of their health. Start tracking very carefully how often you wake up at night to urinate. If it is happening more than once regularly, take that important symptom very seriously. A simple fasting blood sugar could give you a genuinely life-changing answer today. Number 1. Rapid and unexplained weight loss. Most people associate type 2 diabetes primarily with being significantly overweight or obese. And that well-known association is largely and accurately true for the majority of cases. But sudden and dramatic weight loss without any effort is a very serious red flag. When insulin fails completely, glucose simply cannot enter your starving cells at all. Your body immediately interprets this terrible situation as a state of absolute starvation. It begins aggressively breaking down both muscle tissue and fat for emergency daily fuel.
You lose weight very rapidly, but you are absolutely not getting healthier at all. You are literally and desperately consuming yourself from the inside out under complete metabolic crisis. This terrifying process is most dramatic and most dangerous in type 1 diabetic patients. Type 1 diabetics are very often initially thin or completely normal weight at diagnosis. Their immune system has silently destroyed all the insulin-producing cells in the pancreas. Without any functioning insulin, no amount of food can fuel their completely starving cells. Before diagnosis, rapid and alarming weight loss is often the urgent trigger for testing. But this life-threatening breakdown can also occur in severe, uncontrolled type 2 cases. If someone is visibly losing weight fast without any diet or exercise changes, worry. Rapid and unexplained weight loss is never just a coincidence or an accidental gift. It is a genuine metabolic emergency demanding immediate and urgent professional medical evaluation today. Combining this alarming sign with any other sign from our list is extremely urgent. Do not wait for a scheduled appointment weeks away. Seek immediate care today. The final word. High blood sugar does not just make you feel tired and slightly thirsty daily. It silently and relentlessly destroys your kidneys, your eyes, your nerves, and heart. Every single day with uncontrolled blood sugar is another day of invisible, irreversible damage. Your entire vascular system is being quietly and permanently ruined with every passing hour. Feet lose circulation slowly, and wounds completely stop healing, eventually leading to amputations. Kidneys gradually filter less and less until dialysis becomes your only remaining daily option. Eyes deteriorate slowly and painfully until one day the vision simply does not return. All of this devastating progression is entirely and completely preventable with one simple step. Go and get a proper blood sugar test done sometime this very week. A fasting glucose test takes only minutes and costs almost nothing, comparatively speaking, today. It could reveal a diagnosis that completely and permanently changes your entire health trajectory. 80% of people currently living with prediabetes have absolutely no idea yet.
That shocking statistic means the majority of at-risk people are walking around completely unaware. Every single warning sign we covered today genuinely deserves to be taken very seriously. Nausea, dry skin, fruity breath, ketones, breathlessness, confusion, blurred vision all matter deeply. Fatigue, excessive thirst, nighttime urination, and sudden unexplained weight loss are all critical too. Any single one of these signs alone warrants an honest conversation with your doctor. Several of them appearing together at once is a genuine medical emergency without any question. Your body has been talking to you this entire time. Now you know the language. Do not wait for things to get worse before you finally decide to act. The best time to get tested is always right now, not tomorrow.